All right. Thanks so much, Terry. So I'm Megan. I'm the case manager for the City of Waukesha Fire Department. We under a new concept, mobile integrated health, and I just have been telling everybody that we started grant based for my position and worked really hard the last 2 years and fully funded through our own funds as a fire department, first in the state to have a social worker. All right. So the Addiction Policy Forum, we were able to go, that was in early October. Heidi and I went. Um, so the program that, or the training that we have, uh, there's different, I guess, there's like an 8 hour one, and then there's a 3 hour, 2 hour, and then there's a one that they just put out that's 45 minutes, which is awesome. So this program was created by the Addiction Policy Forum, which is a national nonprofit that is working to end addiction as a major health concern. The Addiction Policy Forum was created by families impacted by the disease. It was founded in 2015, and they are working in states and communities across the country to end stigma, help patients and families in crisis, and translate the science around addiction. Their strategic priorities include helping patients and families in crisis, ending stigma around addiction, expanding prevention and early intervention, increasing the uptake of evidence based practice, and advancing research. And to note, Heidi and I got trained to be trainers for this training. Okay, say that 5 times fast. So today we're going to be talking about Encompass. This is the 8 hour training. So it's a comprehensive training on navigating addiction that aims to increase addiction knowledge and just decrease stigma around addiction. The Encompass training is a resource for family members who are trying to navigate the complex world of addiction and help loved ones achieve recovery. The training includes in-depth information about substance use disorders, treatment options, communication strategy, and self-care tips. This training aims to provide practical content to help the attendee understand prevention, early intervention, and treatment of substance use disorders, as well as how to engage someone struggling with addiction and develop an action plan. Attendees will learn the latest science and research about addiction, signs and symptoms of addiction, assessment and treatment options, including medications to treat, how to access recovery supports, how to start the conversation, and how to set healthy boundaries. In 2021, the Encompass program was launched across Ohio with the help of Governor DeWine's Recovery Ohio office. 22 Encompass trainings were offered to community members throughout 22 Ohio counties that had high numbers of overdose deaths. Attendees were provided a pre and post survey to complete that measured addiction knowledge, confidence, and how to respond to a substance use disorder, and levels of stigma, including stereotypes, prejudice, and discrimination. A total of 492 individuals completed the pre and post survey. After reviewing the data, it was found that attendees' addiction knowledge increased overall after attending the training. Attendees displayed improved knowledge of overall substance use disorder knowledge as well as around medication for addiction treatment.
Alrighty. My name is Heidi Begovatz, and I am a case manager with the Rogers Opioid Outpatient Program, known as Worth It. And I'm going to be talking about the Responding to Addiction training. This is the other training that we went and learned about. So this training can be done in either 3 hours, 2 hours, or the new 45-minute component. It has a couple different lengths depending on the, individuals, how long they want to sit for or how long a time they have available. The new 45-minute version just came out a couple weeks ago, and we're really excited to be able to talk about that and offer that to the community members. As we know, a lot of folks have a little bit more limited time, and we can engage folks for a shorter period of time. So the responding to addiction training is designed to increase knowledge about addiction and really develop skills and strategies in the community. This one is really focused on learning the science of addiction and the signs and symptoms behind addiction, as well as like looking at evidence-based treatment options, medication to treat addiction, and engagement strategies. It really focuses on teaching the idea of addiction as a brain disease and really focusing on shifting it from looking at a lot of that idea of addiction is struggling as a moral failing to more of addiction as a chronic health condition. And how do we treat a chronic health condition and looking at addiction from that point of view, which is really helpful when we're looking at how do we defeat stigma, right? When we can treat people as looking at a health condition, which is what this training is really focusing on heavily. This training is really ideal for families, friends, and caregivers, members of clergies, first responders, employers, educators, healthcare providers, community-based service providers, and other community members. It is a really broad training and really open to anybody who might need it. And similar to the 8-hour training, this training also went through a case study, and they saw a significant decrease in stigma with this one. The 45-minute training has not gone through a case study. Like we said, it is new. And so they are working on getting through a case study and getting it all through the journal article yet. So hopefully we'll have that researched in the next couple of years. On top of the other two, or I guess technically 3 trainings, we also brought back with us a whole score of materials. So we have a Ready Built social media campaign. This has posts and videos that can easily be shared online, and we can add other organizations and programs logos to them. We also have a Language Matters fast fact sheets, as well as additional lectures, videos, and research from APF as we need. And it's really nice because these materials are constantly being updated with the most accurate and up-to-date research material about addiction from APF. So our database is constantly being updated on an ongoing live. It's a live database that's shared, and we have monthly calls with them as well.